What's up, fam? Dr. Rick here, and I can't believe I haven't done another video on this sooner. Yesterday I had a patient inquiring as to why they went to one dentist and that dentist said they need 6 fillings, and then they went to another dentist and that dentist said they don't need any. It's such a good question, and it goes to show how different dentists will prioritize their care. So, the dentist who told the patient that they need 6 fillings. Now, I'm not going to talk about dishonesty or any of that stuff in this video because it's not my place to say when people are being dishonest. But what I can explain to you is how dentists think. Unless I have a really good long-term relationship with you, then it comes down to my discretion as your healthcare practitioner. So if I see a patient and it looks like they're on the cusp, they're not completely riddled with decay, but there are definitely a few spots starting up, and you talk to the patient about their flossing habits and they go, oh no, I hate to floss, then I will be more inclined to do more fillings for that patient because number one, they're probably very difficult to motivate to get to a good level of oral hygiene, and number two, if I don't go and intervene at this stage, then their trajectory just continues going downward, unfortunately. It's very difficult without a very strong relationship and a lot of trust between the dentist and the patient to give you a really minimally invasive result that I can guarantee won't result in more issues down the line. So if you're not so with your dental health, I'll probably be doing more fillings for you. And if you're more motivated, and this is another reason why I try, especially after the first time I meet a patient, we take all of their records and x-rays and scans and all the rest of it, and then we just talk, and I show them, like, these are areas where you're going to get decay. Of the 3 layers of the tooth, if the decay is just in the enamel, I have just met this patient, I'll prefer to give them the benefit of the doubt. Encourage them, give them a Sonicare toothbrush, teach them how to floss properly, wait 6 months, and then take those records again and see if anything's deteriorated. That helps me to be a lot more accurate with the way that I'm advising for patients to go through treatment. Some patients, the first time I see them, it's just abysmal. It just looks like if I left them for 6 months, they would be so much worse off than if we did, call it 6 fillings, as soon as possible. We're not trying to get more out of you money-wise, we're trying to get more out of you health-wise. And there is a point at which a tooth has just decayed enough that there's nothing, even if you do get better at brushing and flossing than me, it's too far gone. We have to have a filling eventually. So I hope that helps to clear up some of that confusion, why different dentists will advise you to get different numbers of fillings. It's really not black and white. There is a big gray area in between, and the best piece of advice I can give you is find a dental team that you feel really comfortable with and that you can trust, and trust them. Let them help you. Hopefully we'll see you soon. Thank you so much for watching, guys. If you got something out of this video or if you enjoyed it, please share it with your friends. Otherwise, there's much more on our channel right here. There's another one there, and there's one more right there. Hopefully we'll see you soon. Keep smiling.